So let's use a cannula treatment with a 25 gauge cannula. We can use Revanesse shape, and we're just going to focus on creating a little bit of definition down the midline, really, to enhance the light reflex. And there's one thing I always do for nose treatments, which is, I mentioned at the start, one of the most aesthetic features already Amye has is these curves. If you follow the brow down to the tip of the nose and draw on these lines, you'll see that they're unbroken. And it's one of the first things your eyes look at when we look at someone's face. And in this case, these lines create a very aesthetic appearance to Amye's nose already. And there are little areas you can see where you may want to improve it. So I can see an indentation here and above the dorsal hump. So this area where I'm drawing is where I want to particularly add some volume or a little bit of structure. But I can also create even more clarity to these brow to tip lines. But I would finish the treatment with a midline projected linear thread of filler to create that improved light reflex. So let's start off with a touch of anesthetic so that we have a comfortable treatment. This is always the stingy part for nose treatments, but we're just going to do a little entry point just here. 1, 2, 3. Well done, Amye. Once we've made it nice and comfortable, the rest of the treatment should be relatively straightforward. How was that?
It's fine. It's a bit stingy, but
bit
it's fine.
stingy.
But no, it's fine.
Good. So I'm going to keep these markings on, and I'll show you how we would treat this with a cannula.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
So, making an entry point facing upwards like this, just through the skin. I like to leave this in there for a few seconds just to make sure nothing's been cannulated. It's worth mentioning with the nose that this lower 30% of the nose does not have the same concentric layers. Only when we get 30% up the nose, where the nasalis muscle is where we start having the 5 layers of the face. In this tip, the cartilaginous tip, it's skin, then there's some connective tissue, and then there's cartilage. And so there is no depth control, and therefore the tip is by definition higher risk. Today we don't need to treat the tip, but you'll notice as I start to move down the dorsum of the nose, I meet some resistance, and that's the beginning of those 5 concentric layers of the nose. The vessels run in the subcutaneous depth generally in the nose, and they generally run at either side of the midline. And so deep and central is where I want to be. And we can have a push there, and now I'm in layer 4 of the nose, and I'm gliding down the midline with my cannula. I don't want to add any projection to the bridge of the nose because it's projected. So I'm going to go above the dorsal hump and now add some volume.
You're fanning it a little bit there with microboluses again, Tristan?
Just constant pressure and constant movement with the cannula. And I'm just looking where I can enhance the definition of the curves, the brow to tip curves on the sides, but focusing on addressing the dorsal hump above. Then let's move back over that hump, and now I'm in this supra-tip region where I'm going to again add a little bit of structure. Any pain at all, Amy?
No. A little bit of a discomfort at the top, but
Yep.
fine here.
Good. Take a moment. A very good sign with nose treatments like this is bleeding. So if the tip of the nose is bleeding like this, I'm very happy. We have the dorsal nasal artery providing blood to the tip. And so we really want to see, if we're using needles or cannulas, good blood flow to the nose. I'm very happy with the color of the nose, the capillary refill of the nose. Patient's not describing any concerns with pain. So far, we're very good with the nose. Turn this way. Okay, so that was my first pass. I'm going to do a second pass now to try and just create a bit more of that light strip down the midline of the nose. Much easier to progress into the right depth the second time around. And I'm just going to do my finishing touches now. And then finally, my strip of filler down the midline, stopping at the bony dorsal hump, where we already nicely projected, and continuing again all the way down to the tip. And for me now, that is finished. We don't need to do anything more in the nose. We can always look from the top down, where we've got the best angle to assess for symmetry. And really important, chin up, that we check for capillary refill. Any pain, Amy?
No, no pain.
No pain. Good. So let's take a look at this if you sit forwards for us. Lovely. From the side, I can see a really beautiful straightened dorsum, and I'm going to show you this as Amy turns her head. Turn all the way this way.
Wow.
You see that? And this way. So we didn't need to use a needle for this. Needle would be a higher risk way of injecting the nose. So I'm perfectly happy using a cannula in cases like this. Head back. All right.
Perfect, thank you.
We good?
Yeah, perfect.
Finishing touches now. Chin. So now focusing on the chin, how do we determine a chin? Well, we can think about a feminine chin or a masculine chin. In this case, the width of the chin lives between the intercanthal distance, the interalar distance, and the width of the chin. So this is a very characteristic of a feminine chin, which suits Amy's face. Okay, we have a dimple down the midline, and as I mentioned, there's a little bit of flattening as well. I don't want to create any more width to the chin, but I do want to create some inferior projection. And so if we think about the bony target for the chin, we have the mandible, and the mandible has a portion facing forwards. Okay, that would be your pagonian. Then we have a portion facing slightly forwards and slightly down, which is your gnathian, and then we have the area facing downwards, which is our menton, which is projecting downwards. And that would be the area that we want to inject today to try and create some length to the chin. Think about the filler following the track of the needle. So if we create a midline injection at the base of the mandible on the underside, That's how we're going to create some length and projection. In doing so, I hope we can also reduce the midline dimpling in the chin, which is something Amye said she wouldn't be sorry to see go away. Okay, so that's the strategy for the chin. Now, the reason why we choose the midline as our first injection point is because embryologically, the midline is going to have less vascular structures than either side of the midline. We know that in the chin we have the ascending mental arteries which run either side of the midline. And so we want to be in the midline where possible, but also to improve the safety of this injection, we can also use a 25 gauge needle, which is going to help us get a more sensitive aspiration. So let's sit you back. So we're going to find the bony underside, right in the midline, little injection, touch down onto bone. Really important that we make sure we find bone. Okay, and here we're going to aspirate. And now I'm going to slowly inject. We're using a high G prime product here to simulate the bone that we're trying to project. Any pain, Amye?
No.
Another nice slow injection speed there.
I can see it forming around my needle. I'm going to continue injecting until I'm happy. So from the top, chin up for me. I can give this a little bit of a massage now. But I can see that we've removed that indentation. The filler hasn't tracked too much away from my injection point.
The midline of the chin, we've got bone, and we have a deep fat pad, and then usually either side, in most cases, we've got the mentalis muscle.
Yeah. So I think that's really all I wanted to do for the chin. I'm just going to treat this labiomental crease with the same product, and then we'll have a look at the entire treatment result. Scratch. Treating the labiomental crease, sometimes you have to go from each side, sometimes you can manage it just from one entry point. The purpose of this is to push down the mentalis muscle and to reduce the shadow beneath the lower lip. This in turn will elongate those lower 2/3 of the lower face. So we have to detach the mentalis fibers that insert into the skin slightly. We can do a zigzag pattern like this as we slowly fan in some product at the same time. And you can see from this position, I can treat the entirety of the labiomental crease from one entry point. It's not always this straightforward though.
Patients will often feel that their lower lip goes numb following this treatment, so again, you just reassure them that that's completely normal and it's transient.
after that treatment. Bit rough, that one, wasn't
That
it?
was a wee bit rough. Yeah.
I'm going to just feel it here, and you can feel the gel sitting nicely across both sides. But what that's done is it's really softened some of the tension in the chin, and I think that goes nicely with this new projected chin. So let's sit you forwards now, and we'll have a look at the full finished results.
Thank you. Sorry, I was a bit of a wimp.
No, you won't a wimp. You won't a wimp at all. Let's look into that camera. I'll definitely show you afterwards, okay? But just chin down a little. First of all, any pain anywhere?
No.
I'm going to check the capillary refill around the chin. Good vascular supply, again, around the nose. Capillary refill normal. So, really happy with this treatment, okay? I hope you can appreciate the beautification treatment that we've done. Cheek apex, lateral zygoma, piriform fossa, tear trough and palpebromalar groove, the nose, the chin, and the labiomental crease. Comfortable?
Yeah, all good.
Is it okay?
Yeah, just it's a bit numb, that's all.
Okay, take a look. Tell us what you think.
No, that looks amazing. Thank you very much.
What do you notice the most?
Probably the nose. I think the nose is the biggest change, yeah.
Okay, great. Thanks for watching, everyone. Hope it was a good case. We'll see you next time.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Remember, I was telling you about my patient, Amy. It was only on Thursday that we did those filler treatments, okay? How are you feeling after those?
So, feeling good, yeah.
Yeah? Amy was saying that there was some swelling. It's quite painful for the first few days. Well, not painful, but a bit sore.
Just a bit tingly, yeah.
A bit tingly if you turn this way. That's actually, given that we did a good number of mils of filler, very low level of bruising. So this is what your patient will look 3 or 4 days after treatment. And the sharpness that we see, I'm very happy with the kind of the chin, the definition of the nose as well, the cheekbones. It will just settle a little more. And I'm going to bring Amy back in a month's time and we'll see. But there's always this drop off of the projection that you get from the filler as the inflammatory phase drops off. And so it will be ever so slightly more subtle than this, but it will still be noticeable. So today we're going to do the second part of the treatment, which is a toxin treatment, okay? And as I was saying to you today, there's nothing quite like toxin for reducing those dynamic lines in the upper face. And I think Amy's a very good candidate for toxin. Have you had Botox before?
Yeah,
Yep.
6 months ago.
6 months ago. Let me just get a little clean. So we're using Clinicept here. It's a very kind of accommodating skin disinfectant. Doesn't create any redness. You don't need to use chlorhexidine or anything like that. And then we're going to examine and decide where we want the toxin to go. So look into that camera for me, please. Now I want you to give me a really big frown. Okay, as angry as you can. Okay, so we've got this is areas, the glabella. It's comprised of 3 main muscles. We have the procerus muscle, then we have the medial head and the tail of the corrugator. And these are the typical 5 points that we would use in a glabella toxin treatment. When we inject this muscle, or this complex of muscles, frown for me, these muscles pull the brows down. If your patients come to you and they want a a lift, a brow lift, okay? The simplest way to achieve that is to just treat the glabella. If you do that, those muscles will relax, the eyebrows will go upwards, okay? Raise your brows for me as high as you can. Really beautiful expression lines here. So we have a very nice shape to the frontalis muscle, which is the forehead muscle. And this is the only muscle in the face that's pulling the brows this way. So what's going to happen if we put Botox in these muscles? Brows will drop. So first thing I'm going to teach you is your patients would be much happier if their brows go up than down, right? Generally, okay? Which means that we don't usually want to treat this muscle in isolation. If we treat just the frontalis, it will drop. The brows are between two different poles, okay? Pulling down is the glabella, pulling up is the frontalis. If you treat the frontalis on its own, everything will drop because the glabella is still pulling down. But if you treat the glabella first and then the frontalis, you'll create a stable position for the brows, and you can even tweak positions. You can even make things a little bit lifted or adjusted. So turn towards me. So what I like to do is I like to feel the temporal crests. These are the bony lateral margins for our injection. Raise up for me. This is a fairly standard contraction pattern, and I'm making sure that I'm treating where the muscle is active all the way laterally and where the contraction covers the upper part of the frontalis. Raise up again. There's something called the C line. Yeah. 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 I'll come back to you. So there's contraction all the way up to the hairline here, and there's also this upper part of the frontalis which is actually pulling the hairline down, and the middle part of the frontalis which is meeting that line called the C line. And so we want to make sure we got good coverage. We can generally treat deeper in the upper part of the frontalis and a little bit more superficial in the lower part of the frontalis. Turn this way for me. Now close your eyes and open. Close again and open. So you notice that there's a flicker and a bit of movement of the frontalis when Amye opens her eyes, which means that if I really reduce all the movements, she actually needs some of that frontalis to actually open her eyes. So I'm not going to completely eliminate that movement because I'm concerned it might create a little bit of heaviness on the eyebrows like this. So I'm only going to use 2 units per point for the frontalis injection. Raise up again and relax. That's perfect. Now big smile around the eyes. Squint as much as you can. That's the one. So this way, big squint and relax. This muscle is the lateral aspect of the orbicularis oculi muscle, particularly this upper point here. If you relax this, you get a lift to the tail of the brow, which is very nice. I usually put a little bit more here relative to these. Towards me now. Final check, big frown and raise up. And then big smile, relax. Beautiful. So those are the injection points that I'm going to make. This is my botulinum toxin. I made it up earlier. And with toxin, we're injecting a liquid that contains these proteins, and it's measured in units. So I know the units that I need to get the right effect, and I'm injecting the right volume to get the right units. So I'm just going to rest you back a little, like this. Chin down where you can. There, just relax for me. So first injection is the procerus muscle. We're injecting down, touch onto bone, and slowly inject our first 4 units. These muscles originate down onto bone, insert into the skin, and so we want to get the toxin down where the muscle is at its thickest, which is down onto bone. This little one here, I'm much more superficial because there's actually a foramen deep to this tail of the corrugator which can sometimes lead to toxin tracking into a muscle which elevates the eyelid, and that can cause something called a brow ptosis. So we have to be careful in that particular location. So I go deep in the medial corrugator and then superficial in the tail of the corrugator. So that's the glabella, right? That's 15 to 20 units. Now move on to the frontalis. I'm just doing 2 units subdermally here. And I'm keeping it relatively conservative. I don't want to freeze the muscle completely. And I don't want to create heaviness on the eyes either. I'm just going to go a little bit deeper, higher up in the forehead. Perfect. Towards me, Amye. Raise your brows up. Relax. Good. Final one is injecting around the eyes. Turn this way, please. I like to feel for the bony orbital rim. Injecting away from the eyes is a good thing for beginners to appreciate, just to be safe.
Is this subdermal or?
And this is a subdermal injection, yeah. The orbicularis oculi, very superficial muscle. All the way this way. Just protect the eye. And then 1, 2, 3. All right, and just sit forward and back, look into the camera for us, please, Amye. Perfect, so 3 areas of toxin. This is what it looks like immediately after toxin. You've got these little bumps of fluid. That will take 10 minutes and they'll be gone. And we'll bring Amye back to a clinic next month to review how everything is settled. All right?
Perfect. Thank you so much.
Thank you.